Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Payne for the Ask Dr. Payne segment, where he will answer your medical and cosmetic surgery questions. Dr. Payne, this week's question comes from Instagram, and the question is, a person wants to know if do they need a thigh lift or lipo procedure? Would they be a good candidate for lipo on the abs, or is a tummy tuck or a mini tummy tuck necessary as well? Apparently, they've gained over 60 pounds with a recent baby, and were not able to get their body back. They've had a C-section, and also, so they're interested in a few procedures here. What would you suggest in this situation?
Yeah, well, I'll describe the photos from what we saw. Basically, the person's got the scar with some tissue coming over it, and the abdomen, a little bit of looseness of the skin, not a lot of excess skin. So for this, we'll start with the abdomen. So for this abdomen, liposuction is going to be okay. It's going to reduce the pinchable fat, but if they want the belly flatter, I would recommend a tummy tuck, and probably not a mini tummy tuck. Some people will tell you they can do a little small incision, and then all of a sudden when you get in there to the consultation, they'll tell you that you need the full incision. I'm going to just tell you that right up front, because with this kind of situation, you're not going to get a good result from a mini tummy tuck in most cases, because that entire area of skin from the belly button down can be removed. With a full tummy tuck, the scar is only slightly larger in terms of length, and the result is a lot better. If they just wanted to reduce the pinchable fat and they were okay with the skin not being very tight, then liposuction is all right. You can reduce that to some degree. Sometimes you get a pretty good result with it, but I don't push that one in this kind of case, because the priority should be removing the skin and tightening the muscles on the inside. But it is an option for some people. With the thighs, it didn't look like there was a large amount of skin looseness, but there was some skin looseness at the top, up, toward the groin area. In that case, the person could do a thigh lift. Tend to do it. We get a pretty good pull up there by leaving these scars. For this particular person, the scars would be hidden with standard undergarments. This does not need down the leg type scar for the thigh lift. So a thigh lift is an option if they want to go that route and tighten the thigh skin even more. But not a lot of laxity, but they could do it. I probably would not combine this procedure with a full tummy tuck, depending on their background and medical history and everything. With a mini, it's a little easier to do, or if they wanted to do just the liposuction. So a full thigh lift and a tummy tuck is going to be safest in two procedures. Not absolutely necessary to do it in two, but most of the time. And again, that depends a little bit on an in-person examination, background, the medical history, and so forth. So preferable is the best choice. The others are possible options. And then for the thighs, I think a thigh lift is very reasonable to be able to enhance the contour with the scars that are required, and doesn't need the down the leg scar. So hidden scars for that one should be quite reasonable.
All right. Well, thank you, Dr. Payne. We appreciate your time. And if you have a question for Dr. Payne, please visit our website, Facebook page, Instagram, or Twitter. And Dr. Payne, we'll see you on the next question.
Great.